Good morning, everyone, and thank you for joining me today. I'm Dr. S.K. Singh, and I'm pleased to welcome you to this presentation. Today, we'll be discussing AQL sampling after inspections for vials and ampules. In this session, we'll go over the key principles and procedures involved in sampling, as well as best practices to ensure quality and compliance. So, let's get started and explore this important topic together. Welcome to this slide on introduction. Let's start with the question, what is AQL? Well, Acceptable Quality Limit, or AQL, is a statistical quality control method. It helps us decide whether to accept or reject a whole batch based on inspecting just a sample, rather than checking every single unit. This approach is efficient and practical. AQL represents the maximum defect percentage that a batch can have and still be considered acceptable under a specific sampling plan. So, if the defect rate is below that threshold, we can confidently say the batch meets quality standards. Now, why do we use AQL specifically for vials and ampules? There are several key reasons. First, sterility and patient safety are paramount. Ensuring our products are safe and sterile is non-negotiable. Second, efficiency plays a big role. Instead of performing destructive tests on every unit, which can be time-consuming and costly, we can use sampling plans based on AQL, saving resources while maintaining quality. Third, using AQL allows us to make decisions that are statistically defendable. This means our choices are backed by solid data and probability, reducing uncertainty. Finally, regulatory bodies expect and often require sampling plans that follow these statistical principles. Aligning with their expectations helps us stay compliant and ensures consistent quality management. So overall, AQL is a powerful tool that balances quality assurance, safety, efficiency, and regulatory compliance in our processes. Let's take a closer look at regulatory and industry expectations. The USP 790 standard states that parenteral products should be essentially free of visible particles. When there's a concern, this requires us to perform 100% inspection and sampling verification to ensure product quality. The FDA also provides guidance on visual inspection, recommending that after an initial full inspection, we use AQL sampling plans, such as ANSI ASQ Z14 or ISO 28591, to verify quality efficiently. Additionally, having clear visual inspection SOPs for vials and ampules is a must within GMP systems. These procedures help maintain consistency and compliance across manufacturing processes. Now, why do we emphasize AQL for vials and ampules? Well, first, it's all about ensuring sterility and patient safety. We want to catch any visible particles that could compromise the product or patient health. Second, using AQL is more efficient because it avoids destructive testing of every single unit when it's not necessary. Instead, we can rely on statistically sound sampling methods. Third, this approach supports making decisions based on solid data, which is crucial for quality assurance. And finally, aligning with regulatory expectations for sampling plans helps us stay compliant and ready for inspections. So, integrating these standards and sampling strategies is key to balancing quality, safety, and efficiency in our manufacturing processes. Let's take a closer look at the different types of defects we might encounter, especially in injectables. We generally categorize defects into three main groups. Critical defects are the most serious because they directly impact safety, such as cracks or contamination. These are the issues that could pose risks to patients and are therefore strictly regulated. Then we have major defects, which affect the use or performance of the product. For example, improper fill levels could compromise effectiveness, but might not be immediately dangerous. Finally, minor defects are usually cosmetic or involve slight deviations that don't affect safety or performance, but might affect appearance or quality perception. It's important to note that regulatory standards typically demand that there are no critical defects in an acceptance quality level sample. That means, during inspections, critical issues should be entirely absent to meet compliance. Now, moving on to the standards we use for sampling. One of the most common standards is ANSI ASQ Z14, which is equivalent to ISO 28591. It provides a structured way to determine how many items to inspect and how to evaluate them. We also use different inspection levels, like Level I, II, and III, where Level II is considered normal inspection, what we usually perform. For smaller sample sizes, especially when justified, we might use the S-Series inspection levels from S1 to S4. These allow us to adapt our sampling based on the context, balancing thoroughness with efficiency. All of this helps us ensure the quality of our injectables while adhering to regulatory requirements and maintaining consistent standards in our quality control processes. All right, now let's talk about how to select the right sample size for your inspection. The first step is to identify the batch or lot size. Knowing how big your batch is helps determine the appropriate sampling plan. Next, you choose the inspection level, which can vary depending on how critical the product is or the level of inspection you want to perform. Once you've selected the inspection level, you'll determine the code letter. This code letter is essential because it links to specific sample sizes and acceptance or rejection numbers. Using this code letter, you can look up in the AQL table the exact sample size and the maximum number of defects allowed for each defect category. Here, I want to emphasize that this process helps ensure consistency and objectivity in your quality control. And as you can see in this simplified example of the AQL table for normal inspection, each code letter corresponds to specific sample sizes and limits, making your decision process clearer and more standardized. Remember, choosing the right sample size is crucial for balancing inspection costs with the level of quality assurance you need. Let's look at this smaller batch example with 400 units. In this case, our sample size is 80. The acceptance quality level, or AQL, is set at 0% for critical defects and 1% for major defects, just for demonstration purposes. This means that we would accept the batch if we find 0 critical defects and up to a certain number of major defects, which you can see in the table. The key point here is that 0 critical defects are allowed in the sample because critical defects could pose a safety risk, and we simply can't accept any of those. Now, moving to the previous example with a larger batch of 5,000 vials. For this, we use inspection level II, which gives us a sample size of 315 units. The AQLs are a bit different here: 0.1% for critical defects, 0.4% for major, and 4% for minor. Based on these, we have specific accept and reject numbers, like for critical defects, accepting if there is 1 or fewer and rejecting if there are 2 or more. For major defects, accepting up to 3, rejecting at 4 or more, and for minor defects, accepting up to 21, rejecting at 22 or more. So if we find only 2 major defects in our sample, we would accept the batch. But if we find 4, then the batch would be rejected. This AQL sampling plan helps us systematically determine whether a batch meets quality standards, balancing inspection effort with risk management. It's a crucial part of ensuring product quality while maintaining efficiency in our processes. Let's take a closer look at the AQL calculation. The AQL percentage represents the theoretical average defective rate that's acceptable over many lots. It helps us set a standard for quality, ensuring we don't reject good batches or accept too many defective ones. Acceptance defines the maximum number of defective units we can find in our sample without failing the batch. If the number of defects exceeds the reject number, then the batch is rejected. It's a way to maintain consistency and quality control across production. Now, moving on to visual inspection and sampling. We perform a 100% visual inspection of each vial or ampule for particulates and critical defects, following USP 790. This thorough check is essential for safety and quality. But we also use AQL statistical sampling to verify the overall batch quality and the effectiveness of our inspection process. Combining these methods helps us balance thoroughness with efficiency, ensuring that we maintain high standards without inspecting every single unit blindly. Ultimately, this integrated approach helps us uphold product quality and safety, which is what our entire quality assurance process is about. When a batch fails an AQL inspection, the first step is to investigate the source of the defects. This helps us understand whether the issues are isolated or systemic. Based on what we find, we might apply additional tightened sampling to get a clearer picture of the batch quality. Sometimes, we may need to perform a 100% inspection or extend the sampling size to ensure we're capturing all defects effectively. In more serious cases, a batch might be rejected altogether, and we would initiate CAPA, which stands for Corrective Action and Preventive Action. This is critical to prevent future failures and improve our processes. Throughout this process, it's essential to document everything thoroughly and justify our decisions according to our site SOPs and regulatory expectations. These steps are fundamental to maintaining product quality and compliance, and they tie directly into our overall goal of ensuring safety and efficacy in everything we produce. Let's talk about some best practices to ensure our visual inspection processes are as effective as possible. First, it's crucial to use validated lighting and background setups, typically black or white, at our check stations. This helps inspectors see details clearly and reduces errors. Next, we need to make sure that our inspectors are properly trained and qualified according to FDA and GMP standards. Well-trained personnel are the backbone of a reliable inspection process. Then, it's important to have documented standard operating procedures, or SOPs, that are aligned with ISO and ANSI sampling tables. This consistency helps maintain quality and compliance across all inspections. Finally, we should always ensure randomness in our sample selection. This reduces bias and helps us get an accurate picture of the overall quality. By following these best practices, we're reinforcing the integrity of our inspection process and supporting our overall quality assurance efforts. In conclusion, AQL, or acceptable quality level, is a statistically justified method for evaluating the quality of vials and ampoules. It provides a reliable way to ensure that the products meet quality standards based on solid data. When we combine AQL with 100% visual inspection, we're able to effectively address both safety concerns and regulatory requirements. This dual approach helps us catch any issues while maintaining compliance. It's also important to emphasize that following ISO and ANSI sampling standards is essential. These standards guide us on proper sampling procedures to ensure consistency and fairness in our assessments. Additionally, having well-documented standard operating procedures, or SOPs, is crucial. These create a clear framework for the inspection process. Lastly, implementing risk-based AQL levels allows us to prioritize quality efforts where they matter most, balancing safety, efficiency, and compliance. Overall, by integrating these elements, we create a robust quality assurance system that upholds both safety and regulatory expectations throughout our manufacturing process. If you need any further support or have questions after this presentation, please don't hesitate to reach out. We're here to help you implement these ideas effectively. Feel free to contact us through the details provided. Thank you so much for your time and attention today. I appreciate your engagement and look forward to supporting you in your journey.